Welcome to Hidden Secrets to Health. I am Christina Cole, your host. I'm a functional diagnostic nutrition practitioner and certified health coach. And the purpose of the Hidden Secrets to Health is to really help the average person uncover different ways of healing modalities beyond what you see in commercials and what you get a lot of times in a Western practice. And so today I'm super excited to have Dr. Christine Burke on with us today. She is a Western practitioner who has incorporated functional medicine into her practice. And that's my favorite method of healing because it really brings in the brilliance of these two different modalities. So I'm super honored to have you on the line. Thanks for joining me, Dr. Burke.
Thank you, Christina. It's wonderful to be here.
So you started off doing Western medicine, and I'd really like to expand on how long you were doing that before you found functional medicine.
So as soon as I left residency, I went into private practice, and I grew a pretty large family medicine practice, had about 8,000 patients, had 5 providers. And we were doing everything the way that we had been taught. We were doing all of the preventive testing. We were following all of the practice guidelines. And what I noticed over about 15 years is that many of those people who'd been with me that whole time, they weren't getting healthier. Their health was actually declining. And we were diagnosing things, chronic diseases, like we were diagnosing high blood pressure and high cholesterol and type 2 diabetes and dementia. And all of those people, most of them anyway, did what I asked them to do, but their health just continued to decline. And our approach was just to add more medications to try to prop things up. So I started feeling like there had to be a better way to do things. And I started looking for that. And I was at a conference on bioidentical hormones, and I happened to be seated next to this other doctor at lunchtime. And he was talking about all of those things that I'd been craving that weren't a part of my Western training, things he was able to offer his patients, natural healing methods, and the results that he was getting, and then also looking for root causes for disease, which is something else that I felt like I was missing. And so I stopped him and I said, hang on, where do I go to learn what you know? And he said, I think you want to look into the Institute for Functional Medicine. And that was how I started my retraining into the specialty of functional medicine.
That's amazing. And what a gift to your clients, because, when your patients are coming in and you're seeing this, I think there's probably a lot of practitioners out there who are frustrated because they are doing all the things that they've been taught to do, and it's not working, right? And we have this chronic health condition. And it used to be that we would have relatively good health, and then maybe we would have something that was like a cardiac arrest or something serious that happened, right? But now it's like we have this creeping illness. And so you went to functional medicine, you went to IFM. How long ago was that? And how has your practice changed since incorporating that?
So I started learning about functional and integrative medicine about a decade ago. And I was certified in functional medicine about 4 years ago. And so I've been doing principles of that for the better part of a decade. And it's definitely evolved. It's an interesting thing, and I'm sure you've experienced the same thing. It's like the more you start to dig back into our physiology and our biochemistry, which is really critically important to understanding the root causes of these chronic illnesses, and particularly more complex chronic illnesses, the more you dig into that, the more you realize you don't know, or that we collectively don't know. Yeah. Whereas before it felt really comfortable. I felt like I really had a handle on what it was that I was supposed to be doing and how I managed different things. So that kind of turns things upside down when you realize the incredible complexity of the body, and that we end up in this very superficial zone of diagnosis and symptom suppression so often, particularly with chronic disease.
Yeah, it's so true. It's like that ball of yarn, right? Where you pull the string and like these other things come out and you're like, wait, no, okay. And so you almost are like, all right, well, we're going to keep moving in this direction, but now I'm going to go over here and do this research about something else that's happening, because everyone's different. And one of the things that I do share with people when I do a talk is you could have 10 people in a room and they could all have the same quote unquote symptoms. But the reason that they have those symptoms could be different for every single person. And so it's that unraveling process is, that's really the basis of functional medicine, is teaching people how to start pulling on the string and unraveling. And then there's also a method to the healing process, right? Like you can't just throw a dart at one of these symptoms and figure that must be the root cause. So let's talk a little bit about that.
Yeah, that's so true. And I think that stems oftentimes from our perspective that we have in conventional medicine, where we've developed, really starting with the antibiotic era, this magic bullet thinking that, and we're always looking for that next, silver bullet, the next drug that's going to fix whatever ails us. And that works for acute illnesses. But when we apply that to complex chronic illness, what we find is that it's not enough. And it stems back from exactly what you just said, that each of these things, although the expression may be diabetes, the root causes can be varied and usually are not just one thing. It's not just this exposure or this food choice causes this illness. It's this plus this plus this plus this ends up being that illness in that person. And so the process of unraveling is much more complex than you just need to find the one thing that you're doing wrong. And I think that's why so often people end up frustrated, is that they'll put a lot of effort into doing the thing that they think they need to do. Let's say, taking gluten out of their diet, for example.
Right.
And they see improvement, but they don't get well. And then they get frustrated because they can't quite get over that threshold where they really feel like they're finding true healing. And it's because that whole process is just more complicated than that.
Yeah, that's a really good point, because I do feel like I just see in my sphere of people that people become either very stubborn or that this is going to work and this is what I'm doing and I worked with this person and this is it, or they're really resistant. And it's like, no, and we are trained for the magic pill, right? And everyone has one. There's so many magic pills out there. It's absolutely amazing. And so, right. So it's a little bit of a combination, because I know sometimes my struggle is people not wanting to make their lifestyle changes. Like if you really want to feel better, you have to make real lifestyle changes, and they want that magic pill. So what do you do with those people?
Yeah, that is a really challenging piece of it. And I think, part of it comes from how we've really all been trained and conditioned that the medication is going to be the thing that fixes us. And so we come to the doctor, we come to our healthcare practitioner with the idea that they are going to do something for us. Mm-hmm. And in functional medicine, it's really much more of a partnership. Our role as providers is to help identify the root causes and figure out what we need to do to unravel those. But the real work is in the hands of the patient. And they have to be willing to change the things, change the reasons that they ended up with the imbalances in their physiology or imbalances in their biochemistry that ultimately led to the development of this disease. Mm-hmm. They have to be willing to go back and change those things. And that can be a process. So we evaluate people for a thing that I'm sure you're familiar with called therapeutic readiness to change. Yeah. How willing are you to make changes in your lifestyle? Because that informs our treatment decisions. Because if someone's at a place where they're really not ready to do that, then you're working on, building rapport with them and helping them to see maybe what they might want differently from their life, instead of just focusing on, okay, we need to transform this illness or we need to transform your behaviors if they're not ready. So assessing that's really a key part.
And so I know you guys, because you have a practice with Dr. Mark Holthouse, that you utilize health coaches to sort of pave that way. So how do you integrate health coaches into your practice to make it the most beneficial for your clients?
Oh my gosh, health coaches are so key. It's absolutely integral to the practice of functional medicine, or even just lifestyle medicine, which is a core, the core foundation of functional medicine. So we utilize the health coaches to help people with compliance with the treatment plan, to help them to navigate implementing changes into their lifestyle. So we talked earlier about a gluten-free diet. That's a very, popular, trendy thing right now for a lot of reasons, and it helps a lot of people. But learning how to do that is a process, and people will run into obstacles. They have to go out for client dinner meetings, or, whatever the situation may be, and the health coach can help them figure out strategies for navigating that. They can help them when they're stuck in their behavior change, or they're stuck in a certain pattern of behavior or relationship patterns that interfere with their ability to incorporate change. And sometimes that's relationships with other people, sometimes that's relationships with food, and sometimes that's relationships within themselves, things that they don't value their own health, or they're the caregiver in the family and they're always giving and taking care of everyone else, and they put themselves last. And that works for a while, but then when that person's health starts to be compromised and they need to be the one that's prioritized, they don't know how to do that. So the health coach's role is so multi-layered in all of the pieces of helping people with behavior change. And then also identifying healthy sleep. How do you create an environment that allows you to have healthy sleep, and what are the barriers to that? And exercise. How do you start to implement exercise in your lifestyle, or movement, as we like to call it, because a lot of people find exercise to be a bad word. Just moving your body. How do we want to start doing that? And then the food piece we talked about, and stress management. And a lot of times people are really resistant to the concept of stress management because they look at it as the external forces of stress in their life, right? Like, I can't control that my job is super stressful. And our response to that is, you're right to some extent, but we'll accept that at face value. So now what do we need to do? What do we need to teach you so that you can transform the way that stress impacts your physiology? Because in the end, that's what we need to do. You don't have to live a stress-free life, but you certainly have to be able to transform the impact of that stress on your body.
Absolutely. I mean, it's you kind of went through what, as an FDN, we call the DRESS protocol, which is diet, rest, exercise, stress reduction, and supplements, which we haven't talked about that yet. But that's sort of, that 5 key things that you need to do to make changes. And I think it's really interesting that you bring up the various ways that stress impacts you, because I've been asked that question a lot of times. Like, are you going to fix my stress? Like that, like stress just is coming at me and I'm just, like trying to hold it off. And so I always think that's interesting because stress comes in a variety of different ways, right? Like you can have physical stress. So maybe you need to see a chiropractor because maybe you're having, biomechanical stress, or maybe you're having a biochemical stress, which is what we work with in functional medicine. But maybe you're having like existential stress, or maybe you're having emotional stress. And how we process those stresses really dictates whether or not we're going to be able to get well, because stress, I think 80% of all doctor visits are stress related.
That's a huge amount. And so often, that's a really big number, but how many people come into us recognizing that stress plays a huge role in their symptom complex or in their disease? So there's a big chasm that we have to navigate there. And it's tricky too, because a lot of people have become frustrated with conventional medicine because often they end up being told that it's all in their head, or that, there's nothing wrong with them, when they know in their heart and in their body that something's not right, or things aren't working the way that they should. And so we really have a delicate dance as functional medicine practitioners in bridging the difference between saying something is all in your head as kind of a way of dismissing it
Mm-hmm.
and saying the impact of how you process your experiences impacts your health, which is a really, really different thing.
Totally. Yeah, that's a really great description because I do think, and I know people who have, they end up with adrenal fatigue, which we don't really use that term anymore, right? But it's still, I think it's mainstream enough where most people will understand what that means. And it's kind of like you're being told, okay, there's nothing wrong with you, but you should probably go get in bed and stay there for a month because your body is completely exhausted and it's not functioning anymore. And so it's this weird thing, right? Like it's all in your head, but you need to take a break as well because you're debilitated. What makes me sad is when the best answer is maybe for someone to just go to bed, literally, and stay there and let their bodies recuperate, and instead they're given like a antidepressant,
Yes.
which happens a lot.
A lot, a lot. And so often I find that because as a conventional physician, you're really trained that your toolkit is predominantly medications
Mm-hmm.
and surgery. And so much of what we do focuses around identifying whether or not something warrants one of those interventions. And so we're always, and we want to help people. So if
Yeah.
someone comes in and they have some constellation of symptoms that have been unresolved and none of the conventional testing identifies a disease, the doctor wants to help and they want to give them something to help them. But really what we need to do oftentimes is help them identify what they need to get rid of, whether
Yeah.
that's toxic foods in their diet or toxic people in their life, or it's unmanaged stress, or it's these unhealthy patterns of stress response that we're talking about. And so the medication is given as a band-aid, but we forget to look upstream and try to identify where did this tsunami come from.
Absolutely. Yeah. It's an interesting cascade. And one of the things that I really want to talk about when we come back from the break is going to be the transition you have seen in your practice since bringing in functional medicine. I'd love to give people a glimpse of what that really looks like because I think um, it's an uplifting experience for you as a doctor because now you have these other tools in your toolkit, but also you are like seeing clients walk out the door feeling better than they probably have in 10 years or maybe ever. I mean, that's one of the things, right? Maybe this is the first time they're ever feeling good. And that just makes the biggest difference. So that, and I also am curious to know something that you tell your clients, like every day you probably have a mantra that you say to someone. So once we come back from our break, then those are two top questions I have for you.
Those are really great topics too. I have a lot to tell you about on those.
Okay, good. Welcome back to Hidden Secrets to Health. I'm your host, Christina Cole. And today we have Dr. Christine Burke on the line with us. And we have been talking about how she has integrated functional medicine modality into what was previously a Western practice. And one of the things that I really wanted to talk about was the transition of your practice and what you're seeing since adding in functional medicine.
Yeah, so that we were talking over the break about how we get so used to seeing these amazing transformations that we start to forget how amazing they really are. And some of the things that we see, well, first of all, one of the things that we ask people in their initial intake appointment is, when was the last time you felt well? Because that can often give us insight into what set the decline in motion.
Mm-hmm.
But when we're working with someone that's had something going on for a long time, they don't expect to be able to feel like they did 10 or 15 or 20 years ago, or like you said over the break, ever. They never have felt good.
Right.
Since a child, they've had problems. So it's really fascinating to see people begin to heal from things like that, to not have rashes from eczema anymore, to not need medication for asthma. When we work with people on reversing type 2 diabetes, I used to think it would be impossible to get people off of diabetic meds. It's, once you have it, you have it, and then you have to manage it. But when you do what we do, what you find is that, like in our Help Your Diabetes program, we get 70% of our patients off of their diabetic medications with normalized blood sugars.
Which is amazing.
It's amazing.
Mm-hmm.
And we do it every day. So you start to think, oh yeah, of course you're getting off of your diabetes medication, until you remember what it was like to not, almost never did that happen. And so those transformations just fuel your passion for doing more. You just want to do more and more and more. Mm-hmm. And we implemented a couple of years ago, Dr. Bredesen's RECODE protocol for reversing dementia. And we've been able to reverse cognitive decline in people, even people who are pretty far along in the process, but people who are earlier on in the process, it's almost like a miraculous recovery is possible. We've had people who've been able to go back to work who weren't able to organize their day well enough to be successful at work, or people that weren't able to cook anymore because they couldn't follow a recipe or couldn't remember why they'd taken something out of the refrigerator and put it on the table. They're able to organize that again, to think it through, to go to the grocery store without a list and remember, everything but one thing. I think if you could remember everything but one thing at the grocery store, you're doing
better than me.
Good, right?
I need a list.
Exactly. So these transformations from this one-way direction of chronic disease into true reversal, or at least substantial, amazing benefit and improvement, is really, really fun.
That's amazing because, so for me, part of my healing journey was my family has a tendency of having type 2 diabetes, and not necessarily from being overweight, but just by getting insulin resistance, right? Like setting off that trigger. And I was under the impression that eventually I was going to have this. Mm-hmm. And so I was trying to do a lot of different things to stave off ever having to take medication, right? So and once I started learning about functional medicine, I went back and looked at my labs from over a period of time, and I was like, oh my gosh, I was like on my way. I was going to have type 2 diabetes. Like it was going to be, like any day they were going to say it was time for me to get on my metformin, which was then going to lead to low thyroid and, let's just start the cycle. Yep. And I'm grateful that I learned about functional medicine, just because I would be there. I would be that person. I would be the person coming into your office and saying, I'm doing everything right. I'm not eating any gluten, right? I'm not doing this. I'm not doing that. But there's so much more involved with having some type of a chronic disease. And the gift you're giving people when it comes to dementia is amazing, because I know people who are going through that process with their parents, and how heartbreaking it is I think dementia is sort of like the adult version of autism, where you see someone and you see them disappearing from you. Right.
And what that actually is one of the things that I think touches our hearts the most. Both of us have personal family experience with Alzheimer's disease in particular. And I think, anyone who's dealing with that with a family member, that over time you start to see like the light of that person fade away from them. Like when you look them in the eye, you don't really connect with the person that they used to be anymore. And we accept that as part of the process of that disease and part of the process of the damage to the brain. But the miracle is that we see that light wake back up. And when you see someone go from where, they're present, but they aren't really fully present, to looking you in the eye, and that you're connecting with that person that's in there, and they have humor again, and they have interact with their family again, it's really powerful.
Yeah, it just gave me chills.
I know, it does me too. And I mean, I do it every day, and it still does that to me, because it's just, it really does feel like a miracle. In Alzheimer's disease and conventional medicine, we literally only have one direction of the path. And the medications that we have, although they do help a little, they just raise the bar temporarily, but the person continues to decline at the same rate. It's just from a little bit better vantage point than where they were before the medication. So to be able to accomplish a complete shift in that curve where we're having improvement in memory, improvement in other cognitive skills like organizing or planning, and improvement in social interactions, that's life-changing for a family, not to mention the cost savings.
Yeah.
It's astronomically expensive when people have to go into assisted care for memory care, like $10,000, $12,000 a month. And so we can do something with that person, and they're willing, or their family's willing to help them make those changes in their lifestyle so that we can have improvement. That saves the family tens of thousands of dollars.
Yeah. And just, having to make those decisions. And I definitely know people in my life who've had to make that decision when they finally were like, I can't do this anymore. Like the amount of care that I need to, my dad just wandered off or whatever. And it's like, and I hear those stories. Yeah. And so, then you end up where you are having to put your family member in a care facility, and then you worry, right? You worry about what kind of care they're given. There are, unfortunately, stories of abuse that happen in places like that. And your parent can't tell you because they don't remember.
Right, exactly. And even if they're receiving excellent care, it's a completely different living environment for them at the end of their life. It's very difficult for everyone involved.
And are we not seeing Alzheimer's or dementia happening at a younger age now than we used to? I mean, I know for me, my grandmother, when she went out, she was full faculties. Mm-hmm. Right? Like her personality never changed.
Yeah.
And so that's what we would all like to have, right? Like where you just, when you come to the end of your human experience, you just get to say, peace out and and there you go. But that's not what's happening.
Yeah. We spend so much of the later years in decline and in poor quality of life from the person's experience standpoint, right? Pain and different types of suffering. And we, as in functional medicine, we can make such a big difference in that quality of life. And the sooner people start working on those lifestyle changes, the more profound the impacts can be. Like you were talking about identifying your, kind of genetic weak link, if you will. That's what I like to tell people. Multiple people could have similar exposures or similar experiences, and it could be expressed as different diseases in those people. One person might get an autoimmune disease like Hashimoto's thyroiditis, for example, and another person may end up with diabetes, and still, another person might end up with high blood pressure, because those are all different ways that our body expresses chronic systemic inflammation. And so the earlier we can intervene in those processes, the more impact we can have.
Right. And so for the 30-year-olds out there that have to start taking high blood pressure medication, what does that look like for them? Just basically from like what's happening with your gut, right? Because if you're taking that, then you probably are having acid reflux or gastritis, right? You're having some kind of a pain down there. So kind of, what does that look like for somebody versus if they started making lifestyle changes?
Right. So, if they just follow the path that they're on, it's probably going to look like, an acid blocking medication and a blood pressure medication. And then a little ways down the road, a higher dose of that blood pressure medication, or a second one, or a third one, and some cholesterol medication, because now you have high blood pressure, so your cardiovascular risk is higher, right? And we just gradually start accumulating more and more medications. And if we turn back the other direction and we look for, like you talked about, pulling that piece of yarn, and we're looking upstream for those root causes, now we can start to identify, oh, well, I had a lot of antibiotics as a child because we didn't really know any better back then. And that changed the health of the bacteria that I have in my gut that I share my body with that have way more impact on my health than we ever realized. That's an exploding area of research. And focusing on that, how do I create a healthier microbiome? Well, it's food, and it's probiotics to some extent, but really fermented foods and a great diversity of foods. And there's all these different things that we can do that don't require, pharmaceutical manipulation for us to be able to impact that same thing that we're trying to impact with the drug.
Yeah, so I have 2 C-section babies. So I didn't know like that I didn't know any of that bacteria that they needed to get from me. And so now they're 7 and 5, and I do have to use different supplements to help build up their immune system better, really, because they didn't get that from me. They didn't get that. They were breastfed, so I did that, but I don't know what I was detoxing into them either.
I know the more you dig into this, sometimes it's a little too much information, right?
Yeah. But I do find that, it's like I have to work with them to help them build up a good immune system, which, consists of not giving them a lot of the 3 Ps, the prepared, processed, and packaged foods, right? I have to give them a lot of fresh produce and, going to the farmer's market or having a CSA box. Getting them to have some of these fermented foods, that's a little bit of a challenge.
That's challenging for kids.
Yeah, right. And so like figuring out ways to kind of get those different things into their bodies. Sometimes, I'm like putting magnesium in like a little bit of ice cream, right? And then getting that in them because they, my son particularly gets constipated, and that's not good.
Right. Yeah.
So,
it's challenging. It's challenging because we have the things that get set up without us even realizing it. But there are things that we can do that help to change that. And we know that one of the biggest things that impacts the gut microbiome is actually the food that we eat, and not just the macronutrient choices, the protein, the fat, and the carbs, but the variety of different things. We were talking about what's the one thing that that I recommend to everyone, and it's food. And it's not just any specific diet per se, but it's the wide variety of color of plants that we know has the biggest impact on health. And then the other things, can shift it here and there, but that's really what's going to have the impact. And we look at food in so many different ways. We're used to looking at food as just energy, right? Calories. Right. And then we're used to looking at food as protein, fats, and carbs, the macronutrients. But we also look at food as connection. What do we do when we're celebrating holidays or birthdays or, any big event? It always revolves around food. So there's this connectedness around food. And then we need to also think about food as information, because all of those different plant colors all carry with them a plant pigment that has a specific impact on our physiology and on our health. It can affect our immune system. It can affect our, our digestion, the digestion of our bacteria, our cognition, all of these different things. And then the concept of food as medicine really stems from that, right? That we can harness the things that are in plants and even animal foods that provide certain substrates, certain nutrients for the body that have an effect. And then we're using food just like we're using medicine.
Yeah, one of the things that I found to be fun and useful is showing the kids how certain foods look like certain body parts, right? Like a walnut looks like your brain.
Yeah.
So, hey, this is brain food and it looks like a brain, right? So using kind of that kind of stuff. And when you slice, a carrot, it looks like an eye. Right. So like just these little things it has been a great way of sort of engaging them and trying these different foods. The other thing was from IFM, I actually have that rainbow grid. That you can see like what the different colors do, and they have little dots so you can check them off. Goal of mine is to get that laminated and put it on the fridge so that each kid has their own, and they can kind of go and check off like, oh, I had a beet or.
Exactly. I've done that many times, actually. I've had people laminate it and keep it on the fridge. And then we work out a reward system for the kid. If they check off every color of the rainbow, then, there's some reward that comes with that. Hopefully not a food reward, right?
Right. Yeah. That's the other thing, right? Is always telling people, be really careful about using food as a reward or as a punishment, because we are emotionally attached to food. Right. And you will correlate those things as you become an adult. And so if you want to raise a child to become a resilient adult, separating that reward mechanism of food is really important, because emotional eating is a big topic. And I know health coaches that's all that they do, is they just help people with emotional eating. And it's because it's like, I've had a bad day, I'm going to go get a muffin and a coffee. Or I just did something amazing, I'm going to go get a muffin and a coffee, right?
Right.
So
exactly.
Either way, you're rewarding yourself with something that isn't healthy versus, as an example, when my kids lose a tooth, they get a toy instead of money, because I can't afford the inflation.
Well, and it's interesting too, how we so often, most of the time when we're doing food as a reward, we're picking something that's unhealthy.
Mm-hmm.
And it's like, how are we framing that as a reward? Choosing something that's literally poisoning my body, if you're thinking about it from our upstream mechanisms, and that somehow has become a reward, instead of choosing something that's nourishing my body or that's creating health in my body. So we've got that all turned around as well.
Yeah, we do. When we come back from our break, let's talk about some of the recommendations that you give people on how to sort of implement this into their lifestyles, not just for themselves, but for their family, and how to get people on board with these changes that you're making, because I think that's really huge. And I know it's a big stumbling block for a lot of people, is that they're ready to make a change, but their family is not. So you're in a house full of chips and pastries and whatnot, and you're trying to be over here juicing your kale and your beets together. People are like, ugh. So let's talk about that when we come back from break. Welcome back to Hidden Secrets to Health. I'm your host, Christina Cole, and today we have Dr. Christine Burke, and we are having a fabulous conversation about functional medicine, how that's different from conventional or Western medicine, things that you can do, and also things that Dr. Burke sees a lot in her practice, and how it's changed and evolved by having this additional modality available to her clients. So before break, we were kind of talking about different things that you can do to incorporate this into your life, and how to deal with people that are not necessarily on board. So I know you have the health coaches that help with this, but what kind of recommendations do you give?
Yeah, that is such a challenging scenario. And you're right, it is somewhere that we rely very heavily on the health coaches to help people navigate that. Sometimes if you can get a family member to be willing to do like a short-term trial of something, like they commit to 10 days, for example, we'll often use a 10-day detox as an entry point, because people can feel so much better after they do something like that. And having that personal experience helps them to be able to see that there is something real and valid to what we're doing and what we're asking their spouse, for example, to do. And also for them to get an opportunity to feel what it feels like to feel better, because most of the time this stuff happens really insidiously over time, and people don't even realize that they feel as poorly as they do. And so when you give them this little window of opportunity to experience things differently, it really can be eye-opening. So that could be very helpful. Maybe even just having them willing to, is there one thing that you'd be willing to give up, or fixing the meal? If the person that we're working with is the primary cook in the family, then just making sure that what we're equipping them, the recipes or
Mm-hmm.
whatever it may be, is going to be really delicious no matter what, because that's really important. We talked earlier about food being about connection and enjoyment, and it's very important that food is something that we can enjoy. It's really sad to me when we have people that have become so ill that their bodies won't tolerate anything, and they have had to remove
Right.
so many things from their diet because their body won't tolerate it anymore. That's a huge tragedy, and it's never what we want for anyone. Most people are able to bring most, if not all, foods other than the things that you mentioned before, right? The processed foods and high sugar foods and things of
Mm-hmm.
that nature. But most people, once we've healed their physiology, we've healed their gut and that environment, we've worked on some of those other things that we mentioned earlier. We call them the seeds: sleep,
Mm.
exercise the body, exercise the brain, diet, and then stress management. Once we've worked on those things, most people can get all foods back. There's this percentage of people, like I know you and I, that aren't able to bring all of those things back into our diet because unfortunately we were a little too damaged before we saw the
Right.
light.
Yes, yeah,
But
absolutely. Yeah.
right, so it's another reason, if we can convey that message, if we can make smaller changes now, they have a big impact, and you don't end up having to do a restrictive eating plan. So sometimes some of those things can be helpful.
One of the great things that I love about your practice is that you guys have a lot of different events. And one of the events that I always see come up is you have a cooking class, and it's from somebody who has an organic farm, right? So it's
Right.
like they're introducing maybe vegetables that you don't normally eat or you don't know how to cook. And I think that's a big thing. Like, I don't know what to do with this. I don't know how to make this. And so, we didn't necessarily grow up with the home cooking that's like that the generation prior did,
Yes.
right? And my mom did do a lot of home cooking, but it was a lot of more traditional meals, and over time that's evolved.
Mhm.
So for other people though, they grew up having frozen dinners, fast food. They have absolutely no idea how to cook things,
Right.
and they don't enjoy it. And I think
Right.
partially they don't enjoy it because they don't really know how to do it, and they don't know how to put different things together, and it sort of becomes like a fear thing,
Mhm.
like I'm going to make this, no one's going to like it.
Mhm.
So that's, I mean, besides the cooking class, I know you guys have a few other things. So why don't you tell us some of the different things that your practice has incorporated to help clients through these different steps?
Yeah, so the cooking class, you're right, is one of the things that we really are very proud of. And one of the great things about it's Karen Gould, the CSA farmer that joins us. So she actually has a PhD and then went back and tried to figure out how to bring healing foods to people in an accessible way. So everything that she teaches is really simple and really tasty. So
Nice.
anybody can be successful with it. So that's fabulous. Another thing that's been really helpful for people is grocery store tours.
Mm-hmm.
So taking people with one of our dietitians or our health coach and just going through the grocery store and pointing out the things that they need to be looking for in labels and how to identify, you've got 50 choices. How do I pick the best one? I don't even know where to begin. And a lot of times people think they're making a healthy choice, which is
Mm-hmm.
why they'll often come in saying, "Oh, I eat really healthy." But when
Yes.
you start dialing it in, right, you find
Yeah.
out that yeah, that smoothie of strawberries and bananas every morning is a lot of sugar, and that's one of your weak links. So it's full of good stuff, but it's not right for you.
Right.
Yeah,
Yes. I have done a couple of grocery store tours with clients, and it's actually really fun.
yeah,
It's a really fun experience, and the clients have always been like, "This was so great," and it's something that we take for granted because
mhm,
we've learned this stuff. So,
right.
for any health coaches out there listening, don't be shy of doing the grocery store tours because they are actually a lot of fun, and your clients get a lot out of it. And that really kind of brings me back to eating the foods that are right for you. So this is something that I see all the time, and that is people get on the fad diets, or they go to the gym. Like if I go to the gym, if I go do this exercise every morning and I do this fad diet, I'm going to lose this weight that's sort of stuck.
Mm-hmm.
And that doesn't work.
Right. Right. So yeah, oh my gosh, we could talk a long time about this topic. Actually, we have had so many athletes come in looking to optimize their health because, we do that too. It's not just all reversing chronic
Right.
disease. And they think because they're, out running an hour and a half a day, and they're burning all of these calories, going back to what we talked about before with all of the different ways that food impacts us, they're looking only at the calorie expenditure piece. But
Right.
yes, it's true that they can probably eat a lot more not probably, that they can eat a lot more calories than someone who's not doing that. But if they're choosing the wrong types of fuel, if they're eating a lot of sugars, or they're capping off their run with, a big coffee drink with lots of whipped cream and sugar in it, right? They're still developing insulin resistance. And I'll tell you, those are some of the most shocked people when you're going over labs with them and you're telling them, I know that you're thin and you exercise a lot, but you have prediabetes. And they're like, what?
That was me.
Yeah. How is that possible? Because food is more than those macronutrients. It's all about that information. And if you're set up to develop diabetes, then that food information is turning on what we call the epigenetics, how your genes actually get expressed, and the metabolism that creates. And so the same is true if we're talking about other fad diets like keto diet, for example. That can be very effective as a means to an end. As a lifestyle, it doesn't really provide us with all of the things that we need because it so restricts the carbohydrate intake. It restricts the amount of vegetables that we can bring in. And so now we're limiting that phytonutrient spectrum that we can get in. So good as a therapeutic plan, not probably as something that we want to have as our long-term eating plan. And that's how we like to look at it, is developing an eating plan that's right for that person's physiology and not a diet, because diets are something that you do for a period of time to accomplish something. And then you go back to probably eating how you ate before, which is why there's so much of the yo-yoing. And so
Absolutely.
So we really want to help people change the way they look at food, change what they enjoy from food, because in the end, if what you need is what you crave, it's not about willpower anymore. If every day has to be a battle of willpower, it'll never be successful. You have to create a food plan that is you look at it and it makes your mouth water, because that's what you're going to want to eat, and that's what you're going to want to turn to, and then you're fueling your body the way that it needs to be fueled.
Right. When you're at that point, that's when you've made that transition.
So true.
So for our listeners, how do they find you?
So our office is located in El Dorado Hills, California, and we're at the True Health Center for Functional Medicine, as you mentioned. And that's our website. URL is truehealthcfm.com. And if they're looking for a functional medicine practitioner in their area, they can go to the Institute for Functional Medicine, has a Find a Practitioner division of the website. And so you can search out functional medicine practitioners from all different disciplines. So you may be looking for a medical doctor, you may be looking for an osteopathic doctor or a chiropractor or a nutritionist. They also have health coaches. So all these different practitioners can be located through that system. That's a great way to find people that have had a really high level of functional medicine training, particularly if they've been certified in functional medicine.
That's amazing. Thank you so much, Dr. Burke. I mean, you're just, we could talk for hours because your information is so valuable and your passion is so great that I hope so many people listen to this message and find the message of functional medicine. So thanks for everything you do. I really appreciate it.
Thank you so much. Such a pleasure to be here and have the opportunity to share this and reach as many people as we can.
Absolutely. Until next time, this has been The Hidden Secrets to Health.